delighted that we have a chance to celebrate Carolyn Dresler's award as an unsung hero. There couldn't be a better possible recipient. Carolyn has been quietly working, making basically revolutionary changes in the way the tobacco control movement thinks about human rights. Basically, it's so revolutionary that when she got started, nobody in the tobacco control movement thought about human rights.
The term transformative is often overused. I would like to tell a story in which transformative can be taken quite literally, and it has to do with Carolyn Dresler. Several decades ago, she enrolled in a course I was teaching on health and human rights. Very early on in that course, she expressed her, I guess I could call it outrage, that tobacco control was not a human rights issue as presented in this course. And I suggested that she write a paper on it, and the result of that encounter, it's not exaggerated to say, is history. Insofar as she wrote the paper, which evolved into an article in a major journal that she and I co-edited, and the creation of the Human Rights and Tobacco Control Network, HRTCN. I was awakened, thanks to her, to the critical importance of tobacco control, not only as a major public health issue, but also as a human rights issue. And ever since then, my thinking on this subject has genuinely been transformed thanks to her.
So first, I want to take this opportunity to congratulate Carolyn for this very well-deserved award. Carolyn has been not only a mentor and a friend, but also an amazing leader in the area of tobacco control. She comes with so many different strengths and backgrounds, from being a surgeon and a physician, to then becoming also the expert on human rights. As you probably all know, she was the author behind this seminal paper in the human rights article, really describing the emerging human rights of tobacco control. A seminal piece which has really helped us and influenced a lot of us as we then integrated a human rights-based approach to address tobacco control.
Your impact on public health and human rights has been huge. My knowledge of this impact is through our time together on the board of the Human Rights and Tobacco Control Network. When I first started working with you in 2009, I was super excited that I was spending time with the author of the 2006 paper in Human Rights Quarterly that was a cornerstone of tobacco control and human rights. You and your work helped me be an effective researcher and advocate. Today, I'm chair and associate professor in the Anthropology department at the University of Colorado, Denver. This accomplishment was possible through experiences with you and people you introduced me to in the Human Rights and Tobacco Control Network.
I would like to acknowledge the leadership and facilitation that Carolyn gave to our Human Rights and Tobacco Control Network, HRTCN, over many years. Carolyn was the glue that held us together and that enabled a focus on a neglected area of tobacco control, namely that of human rights and the great insult to humanity that was and is still perpetrated by the tobacco industry. In the midst of a demanding work schedule, Carolyn always brought a positive sense to our collective and enabled us to highlight these issues in a key regional and global forum. This was done in such a pleasant manner that I'm glad it is being acknowledged.
Congratulations, dear Caroline. Perhaps you don't know how much inspiring was for me your strong commitment and kind leadership. You know how to manage visible and invisible international complexity.
It is a true pleasure to record this testimonial on behalf of Dr. Carolyn Dresler, a true public health heroine and someone whom I greatly admire. I've known Carolyn for almost 20 years. By training, she is a thoracic surgeon, and she has seen firsthand the impact of tobacco on patients. She recognized, she was a pioneer in recognizing tobacco as a human rights issue. She has brought together an international movement through the Human Rights and Tobacco Control Network, and this has influenced global tobacco control. It has also helped to broaden the movement. We really need additional stakeholders to make a difference and in fighting the multinational tobacco industry. So I would say that she is a transformative figure in the history of tobacco control. And the Cape Town Declaration on Tobacco and Human Rights is having major impact. So it is a pleasure and a privilege to recognize and acknowledge Carolyn's many contributions and how incredibly deserving she is for this honor.
I'd like to highlight Dr. Dresler's impact in two ways. First and foremost, she operates with an objective of never leaving women behind. She and a few of us made sure that women are given 50% representation in all categories at the World Conferences on Tobacco or Health. Second, she established the board of the Human Rights and Tobacco Control Network, HRTCN, to increase the visibility of tobacco as a human rights issue, once again giving special attention to women and their rights. I am humbled to serve with her on this board.
I met Carolyn over 15 years ago when she was beginning to put together the Human Rights and Tobacco Control Project, and Carolyn was a great inspiration to me, along with my other mentor, Ronkita da Silva. Ronkita brought in human rights law, Carolyn human rights practice, as well as medicine, a long distinguished career in medicine and in public health. Carolyn has done wonderful things with this. It's really transformed the way the tobacco control movement and public health movements internationally today address problems. The human rights approach is now front and center among these approaches, whereas before Carolyn got started, it didn't exist. People didn't simply never use the words tobacco control and human rights together in the same sentence. So wonderful work, Carolyn, much deserved honor.
I want to congratulate Carolyn on winning the C. Everett Koop Unsung Hero Award. I don't think anyone has ever deserved it more. For those of us working in tobacco control, it is so normal today to think in terms of human rights and health equity that it's easy to forget that a decade ago almost no one did. The change would not have happened without Carolyn. And Carolyn, thank you for your vision, your drive, your camaraderie, and your friendship.
Thanks for always being an inspiration, a driving force for good, a super fun travel companion, and for always sharing your chocolate. I'm so glad we crossed paths at GSK and that I followed you out of corporate to broader horizons. With love and admiration.
Let me mention a couple memorable network events where your impact has been long-lasting. 2008, Switzerland, the meeting where the seeds for the network were planted. I was unable to attend this one, but it was a key moment in the network's life. 2009, in India at the World Conference on Tobacco or Health, the multi-day event that we organized was an important one, and I got to meet some cool people, including Mike Crosby, who is no longer with us. Singapore, 2012, Abu Dhabi, 2015, Cape Town, 2018. Lots of good times with you and others in the network. Even though we dissolved the network in 2020, the accomplishments of you and other network leaders lives on in so many ways. Thank you for being you.
Carolyn is an incredible tobacco control advocate. She was one of the first to consider tobacco a human rights issue, and she gave that a huge momentum by founding the Human Rights and Tobacco Control Network. She's absolutely tireless in her advocacy, and she's a huge asset to the cause. Congratulations, Carolyn, on a very well-deserved award.
Carolyn has been such a passionate advocate and volunteer, pushing us always to go beyond, and always making us believe that, and encouraging us to believe that we can really end this tobacco epidemic. So thank you again, Carolyn, for everything you do and for your continued support to our work towards a healthier world. So again, thank you and congratulations for this very well-deserved award.